Now, one of the things that patients often ask me is what is it an osteopath does, particularly over the phone if they're ringing up to find out about what we do. Osteopaths are obviously interested in people who have problems. So typically an average patient might come to see me with back pain, for example. Now, back pain can be caused by lots of different things. So one of the things that an osteopath will do is to take a very detailed case history to try and establish precisely what caused the problem, how it came about, and how the symptoms have evolved or changed over time. We also spend a lot of time examining patients. So we look at how you move and can do a range of different tests, both with regards to your musculoskeletal system, but also special tests, testing your nervous system, testing your reflexes and your strength, to see if there are any other factors that may be relevant or perhaps contributing to the pain you experience. We'll also examine your heart or lungs if necessary. Some patients come with a range of symptoms that could perhaps be suggestive of underlying illness or disease, so we need to be confident that you're safe to treat and that this is the appropriate place for you to be. So we may need to do other tests to help establish whether it's appropriate for you to receive treatment with us. The distinctive thing about osteopathy is that we focus not simply on the pain that the patient presents with, but all of the factors that may have contributed or have led to the patient feeling pain in the first place. Now, sometimes that can be a simple trauma, a slip, a strain, a lifting injury. But more often than not, things can develop over time and it may not be clear to the person why the pain has suddenly started. So we spend time trying to piece together a history of what may have gone before, other injuries to knees or hips or necks or whatever it may be, as well as sports injuries or car injuries, all sorts of different things that might contribute to why you're presenting with us today. And that can then often lead us into deciding what is the best treatment. So for some patients, although they may have back pain, it may also be necessary to perhaps treat their hip or their knee or their neck to help with the mechanics of the spine so as to allow the back to recover effectively and quickly. We also try and give lots of advice about activity, exercises, how to move and use your back, so that when you start to get better, you're also able to take control of your pain and manage things as effectively as possible. And ideally, look after your back so that should you recover but suffer a twinge or a recurrence of your symptoms, you're immediately able to help yourself manage your pain and hopefully not have to come back and see us too often with a recurrent problem. And in the ideal world, you'll be able to manage your pain and be independent of osteopaths or pain relief so that you can live a normal, healthy, active life free of pain.